Today I am going to talk on tapering down of blood pressure medications. Generally, the whole world says that once blood pressure started consuming the medications, then it has to be continued lifetime. As per my view, it's not so. Food is the medicine. And the most important point is, in addition to that, meditation and pranayama. Meditation will gives brain rest. Once you go for brain rest, so automatically hypothalamus gland will activate all the endocrine glands through pituitary gland. So you can't imagine, if you do meditation, enormous energy you will find in your body, and after meditation you will be having a horsepower, and all the negativities will go out, positivities will come in too. Those who are having depression or insomnia or sleeping problem, all those problems will go out through the meditation. And the lungs capacity, the oxygen inhaling capacity also goes up like anything. So this is the power of meditation and this pranayama. Secondly, raw vegetable juice and banana stem juice, flax diet, plus the supplements which I have given, because generally BP is attached with diabetes, and BP, because of the BP, kidney problem is there. Again, because of the kidney problem, more BP will be there. And many times, without taking my supplements, just merely following whatever I have defined, diet and all, those who are consuming BP medications, their BP level actually gone down. They rush to me saying that, thanks sir, now I want to take treatment, and I want to take treatment to my family members and all. So like that, your body is having power, and only we have to nourish your body. Your body is like a baby to you. If you do not care your baby, if you do not protect your body, that is your baby, it will not be with you. So that's why any treatment in diet protocols and all, in my Neo Ayurveda program, if at all the person who is having diabetes and BP, automatically it will become normal. So that's why after 15 days of our treatment, one has to observe, and with the consultation of the doctors, they have to leave these BP medications.